वेलकम टू दिस चैनल। आज इस वीडियो में हम बात करेंगे गाबा एंड बेंजोडाइजेपिन्स। कैसे स्लीपिंग पिल जो बेंजोडाइजेपिन्स है कैसे काम करते हैं, इसके बारे में इस वीडियो में हम बात करेंगे। जो गाबा है, गाबा इज ए न्यूरो इनहिबिटरी ट्रांसमीटर, मतलब है कि ब्रेन का एक्टिविटी कम करते हैं। इसीलिए जब ब्रेन का एक्टिविटी बहुत ज़्यादा होता है तब हम लोगों का नींद नहीं आता है। तब जो मेडिसिन दिया जाता है वो एक्चुअली एक्ट बाय द गाबा रिसेप्टर, जिसके थ्रू क्या करते हैं, पूरा ब्रेन को शांत कर देते हैं और नींद आ जाता है। तो बेंजोडाइजेपिन्स कैसे आपको नींद ला के देते हैं, इसके बारे में इस वीडियो में हम बात करेंगे। तो जो गाबा है, इट इज़ ए न्यूरोट्रांसमीटर। तो गाबा प्रोड्यूस कहाँ से होते हैं? ग्लूटामिक एसिड से, बाय द एंजाइम ग्लूटामिक एसिड डिकार्बोक्सिलेज। ओके, now the GABA has formed in the presynaptic area and it has to be stored in the synaptic vesicle. So who will carry that GABA into the synaptic vesicle is the vesicular inhibitory amino acid transporters. They bring GABA into the synaptic vesicle. From the synaptic vesicle, when they release into the synaptic cleft, now some of the GABA will be go back to the presynaptic area by the GAT, the GABA transporter. Okay, another fate of this GABA is by the GABA transaminase, which makes GABA into an inactive product. So this is all about the GABA. Now GABA has to work on the GABA receptor. That means we need to talk about the GABA receptors. So GABA receptors, there are GABA A, GABA B and GABA C receptors. Three important receptors. These are the three major receptors of the GABA: GABA A, B and C. Remember, GABA B is a G protein coupled receptor, where GABA A and C, they are the ligand gated ion channel. They are the ligand gated ion channels. So what happens now? GABA A, if we talk about the GABA A, it has four transmembrane region, and it has five subunit. Because when five subunit combine together, they will form a GABA A receptor. Now you'll look at the picture. Now what I say, there is four transmembrane region. Okay, there is 1 2 3 4. These are the transmembrane region. You can see, if you combine, this is the transmembrane region, this is transmembrane region, and it needs four transmembrane region. Okay, these four transmembrane region, if they combine, they will make one, plus you need 1 2 3 4 5, like 5 transmembrane region, and they come together, they form a GABA A receptor. That means GABA A receptor में we have 1 2 3 4 5 subunit. We have 5 subunit, and each subunit will have 4 transmembrane region. You need to understand, because the action of the GABA receptor, it will depend on this subunit, right? So you can see, these are the transmembrane, 4 transmembrane, they combine together, and like if we combine 5 like subunit, they form a GABA A receptor. Now what are the subunit? They are also known as isoform. Subunits are the alpha subunit, beta subunit, gamma subunit, delta subunit. There are other subunit also. Important is that alpha has 1 to 6 subunit, beta has 1 to 3, gamma has 1 to 3. Now depending on the which type of subunit made the GABA receptor, it will determine the type of the GABA receptor. So GABA receptor also can be divided, whether they are present in the synaptic region or they are extrasynaptic region. Those are in the synaptic region, they do phase transmission, and specially we need gamma subunit for this, where there is extrasynaptic, they are shows tonic transmission and they will have delta subunit in it. Now, the GABA receptor can be sensitive to benzodiazepine or can be insensitive to benzodiazepines. Who are sensitive? That is gamma subunit are sensitive benzodiazepines, where GABA A, where there is delta subunit, it will be insensitive to benzodiazepines. Now, to talk about the benzodiazepine sensitive GABA receptor, we need 2 beta unit, we need 2 gamma unit and 2 alpha unit. Okay. Now, remember the benzodiazepine binding site between the gamma 2 and gamma 3 subunit and alpha 1, alpha 2 or alpha 3 subunit. That means the benzodiazepine binds between the alpha subunit and the gamma subunit. That is very important concept. Now, if I talk about, we know there are 5 subunit in one GABA receptor. 5 subunit, they will form a GABA A receptor. Okay, GABA A receptor, we need 5 subunit. What are these 5 subunit? It's the 2 alpha, 2 beta and 1 gamma subunit. 1 gamma subunit. You can see alpha, alpha, beta, beta and gamma subunit. Now, important is that what I talked about, that between the gamma and alpha subunit, the benzodiazepines will bind. Matlab the binding site for these benzodiazepines is between the alpha and gamma. Between the alpha and gamma, here benzodiazepine will bind, but in case of GABA, they will bind between the alpha and beta. They will bind between the alpha and beta. And in the core of this receptor, there is a chloride channel. Now remember, when GABA binds to the, so we know that we have a GABA binding site, we have a benzodiazepine binding site. Now if you see, when this is the GABA binding site, this is the benzodiazepine binding site. When GABA bind to this GABA binding site, the chloride channel is open and there is influx of this chloride channel and there is hyper repolarization. That means there is more repolarization and muscle become less stimulated. Okay. But when the GABA is bind to this channel, there will be very less amount of chloride influx will be there. When the benzodiazepine bind, there is also very less. But when both the receptor, both the binding site are occupied by the GABA as well as the benzodiazepines, so the amount of chloride influx is very, very maximum. That means the effect of the GABA is potentiated by these benzodiazepines, what we call as positive allosteric modifier. That is PAMS, positive allosteric modifiers. Like benzodiazepines, other like barbiturate also work in the same process, where the chloride channel remain open for longer time. There are so much of chloride influx into the cell and there will be hyper repolarization. But in case of barbiturate, the amount is so, the duration of opening of chloride channel is longer, so much amount of chloride is going inside. So sometimes it's become very difficult and sometimes it's become very dangerous for this patient also. There is so much of sedation and patient may go into coma and death. That's why barbiturates are not used nowadays, but we have a better control on the benzodiazepines, so benzodiazepines are very frequently used nowadays. Now the GABA A receptor will have alpha subunit. It will be important for sleep, because in the alpha subunit the benzodiazepines and non-benzodiazepines positive allosteric modifier as well as the Z drugs will work. And the GABA A receptor with alpha 2 or alpha 3 subunit, there will be anxiolysis. That means with the alpha 1 receptor, it shows sedation, where with the alpha 2 receptor or alpha 3 receptor, it shows anxiolytic property. So that is very important, because the same medicine, when will act on the alpha 2 or alpha 3, they will produce anxiolysis, but when act on the alpha 1 receptor, it will produce sedation. Now, those benzodiazepines are, that means those GABA receptor are insensitive benzodiazepines. They are mostly formed by the alpha 4, alpha 6 or and delta subunit. Okay, and remember, this is the site. The alcohol will bind on those GABA receptor which have the subunit of alpha 4 and alpha 6 and delta subunit. Even the general anesthetics also bind on the same subunit of the GABA A receptor. So this is in short about the GABA receptor and how the benzodiazepines act, how the benzodiazepine act as a sedative as well as it acts as an anxiolytic depending on the subunit of the GABA receptor. So it is very important to understand the concept of GABA and benzodiazepine receptor, and in the further video I will try to explain in more details with the GABA and benzodiazepine, so that you can have a better understanding and much more knowledge on this GABA and benzodiazepines and their actions and clinical implications. Thank you so much.